Hi, this is Tiffany Cook with Cure Duchenne Cares, and today I am happy to introduce our expert, Dr. Brenda Wong, the founding director of the Duchenne program at the University of Massachusetts Medical Center. So wonderful to have you on today with us. So Dr. Wong, I know there's been a lot of questions about the use of steroids during this time. Can you give us some insight into what your thoughts are here?
If you look at our gene therapy trial subjects, on the dose of steroids that they were mounting for those that had the immune reaction. They were reacting, they were not immunosuppressed, so much so that we actually have to increase the doses of steroids up to at least 1 mg per kg per day of prednisone to 2 mg per kg per day of prednisone in order to suppress the immune system. So I think that would hopefully kind of put into perspective the dose of steroids that we are on, as opposed to how immunosuppressed we are to be like catching viruses and be really sick. So the other thing is, if you look at our Duchenne population over the last 20 years on steroids that we have seen, the kids do not get the flu worse or over and above the regular kids. A lot of them do get the flu, and they're usually fine. But I know occasionally flu can be dangerous. Touch wood, we haven't encountered any of those. So comparing to the normal kids, they're not any more sicker. So I think that's reassuring to know. So really, it then comes down to the COVID as to what are the risks of acquiring COVID. It's a lot based on the public health measures that everybody talks about, the hand washing, the distancing, as well as the mask. I think way back in February, before this whole thing started, the emails that we have shared with families actually was started in February, where we did advise families on the need to really be mindful of hand washing and mindful of being in a social situation where you have a gathering of people, like we talk about, like, religious activities, church gatherings, or dinners, and those are the places that we saw having clusters in other countries, and that's why we actually advised that way back in February. And I think that is the risk of getting COVID is really related to how good we are with those measures and not the steroids per se. So we feel the risk of stopping steroids with the adrenal suppression, adrenal insufficiency are far greater, than that supposed fear of immune suppression and the risk of getting COVID. So I think that's why it's more towards continue the steroids, but make sure that when we're sick with a fever and all, we can easily have another stress dose, and to be mindful that the stress dose of steroids that we talk about actually is only 1/7 or 1/8 of the actual dose that we take. So if we take our dose every day, that is 7-8 times their stress dose. So if we don't miss that dose, we're pretty good shape. But if we still feel sick and we're ill, it doesn't hurt to have another extra stress dose for the day. And if we really are puking and not able to take the steroids orally, then I know some of the guidelines have been, give yourself the injection intramuscular at home. But I think in that instance when we're not well and we're vomiting, having Duchenne, we usually would like to be more cautious and have the patient evaluated to see, in this case, is there a GI cause? Is that COVID, or is there something else that is causing the vomiting, and not just I happen to have, I happen to vomit and I'm not able to tolerate that dose. So we tend to err towards the side of, in that case, get an evaluation, get electrolytes done, get an IV in, and give the IV rather than IM. So I think that's what we tend to tell patients, except if you know that your vomiting is just a one-time thing and you're not able to take anything, you can give the IM, but that means you don't get to be checked out clinically, and I think that is something that we are not comfortable with. If they just self-medicate, thinking it's all adrenal insufficiency and just give an IM steroid, and that's it. So I think that's a caution about the steroids that just want to emphasize a little bit more.
Another question we had that came in was about getting weekly infusions at home. Is that safe, or are there any precautions that should be taken for that?
I think the weekly infusions, by that we're meaning the approved medications or, clinical trials. I would say in terms of the clinical trials that's decided by the site PIs, whether that is necessary to continue or they'll hold it. But in terms of the treatment for the exon skipping medications, the advice is, since it's treatment, to continue that with the caveat that with the home nurse, again, a lot of precautions with regard to hand washing techniques in terms of touching the infusion set and handling the injection, the vial, the syringes and all, and the fact that the mask policy comes in here with checking with the home health companies now going forward if their staff has been tested, especially when I think the rules are relaxed, then people are going to be out. And again, the second wave that we don't know when that will happen. It's really I think, checking with the home health company, the staff, whether they've been tested.
Another question that came in, if a child is suspected of having COVID, a child with Duchenne, is there a specific symptom that we should be watching for?
I think the common symptoms that's been reported, like fever, sore throat, myalgias, like a viral kind of flu kind of symptoms, and they've reported loss of sense of taste and smell. Although apparently that group, they turn out to be milder. And I would also say that now they're reporting like the rare case where patients present with confusion, whether it is infection of the brain or whether it's more of an immune reaction that's also affecting the brain as a result of the virus, we don't know. So bottom line is, if the patient is not at baseline and is unwell with any symptoms, then the patient has to be checked out. I've got emails, where patient has no fever but a little bit of sore throat, or has been a cough that's new and going on. But by the very fact that we have an underlying condition of Duchenne, we got them to be tested. So that's the first step, is to be tested to see whether we are positive or negative. And I think if we're positive, usually here in the US, the patients don't get admitted if they're well, but they're put quarantine. But I think for us here, it will be at the persistence of a fever that doesn't go away and just the general feeling of being unwell. I would recommend that they be evaluated clinically by the pediatrician sooner than later than regular folks to listen to the lungs and to check the vitals. That's something that will be a lower threshold for our patients if they should be positive. Shortness of breath, though, because I think by the time there's shortness of breath, there's a lot of inflammation in the lung.
Okay. I think the key there for me as a mom is hearing you reminding me about baseline, like always know what the baseline was, and if you're seeing things that are changing, then call your doctor. Don't wait.
Right.
Another question, I'm looking at my notes here. So for families who, you know, like the dad may be working outside the home and then coming back at home, should he be isolated from the rest of the family?
I think in some ways there's kind of like extra precautions to be a little bit more isolated. I think, of course, you know, disinfecting surfaces and the dad washing hands and taking a quick shower when he comes home. So I think that's something that will be helpful. When he arrives home, wash your hands, take a shower, clean clothes, change all that out. And then meal times will be more of no sharing of utensils, and you know, working in different rooms. And most of the time, so I don't think, you know, he should be like totally isolated, as to be in a different apartment or building, but
Okay.
more measured at home. Yeah.
Do we need to be concerned about a drug shortage? Is there anything we should do to prepare for one? Are there alternatives for any of the medications that our boys are taking?
I'm not aware of any concerns for drug shortages. Like, I know even where the specialty drugs are concerned, they assured us that they've got supplies for the USA deflazacort, which is Emflaza. I think that's what most families are worried about, and we got assurance from the company that's fine. And the alternatives will be, if in the event that you cannot get hold of Emflaza or deflazacort, the substitute is always prednisone. It's always easy to get from the pharmacy prednisone to stand in for deflazacort or Emflaza until you get your supplies. But most of the other medications, I do not foresee problems with the bone health medications or the cardiac medications.
Another question. So if a child develops antibodies against this virus, would that affect his ability to qualify for gene therapy?
This is a different virus. The gene therapy uses the adeno-associated viral vector. So the antibodies being screened for the gene therapy trials using AAV8, 9, RH74, and so on, the AAV virus. So this is the virus for the coronavirus. So I would not expect that to be confounding your eligibility for trials using AAV vectors.
So that's the end of my questions I have here. But while I do have you on the line, you know how much we adore and just love you so much, Brenda. And I'd love, you know, any words of just heartwarming messaging, anything that you could share with the Duchenne families. I'd love to give you a chance to just share just general words of wisdom.
To the boys and the families of Duchenne's, you have always been a pillar of strength for us, even as providers, and a source of encouragement and inspiration with your resilience and your never, you know, take things kind of going under. We'll just go over it, around it, or just, you know, just over it. So, so even with this COVID crisis, I'm sure you'll do well again because, you know, we have seen them do well for the other outbreaks, for swine fever and all the flu outbreaks. And I think our boys who are really wanting to beat all odds, they will beat all odds, and I'm confident they'll do it again. So just hang on in there with the social isolation, but we're connected through the internet and connected spiritually.
Yes. Thank you so much. Thank you for your time today.
You're most welcome.